COPD, we're going to break it down a little: bronchitis and emphysema, plus what we find whenever we see pneumonia with it. So, COPD is a combination of emphysema and chronic bronchitis. With emphysema, it will damage or destroy the terminal bronchioles and also cause some damage to the alveoli, and it causes them to kind of form up in together and create large blebs, if you will. That's kind of that's the word they use for it, is blebs. But what it's doing is, instead of all of this being nice and separate and you have nice little grape clusters, it's kind of all just merging together and not becoming very efficient, and it breaks down those bronchioles there, and so whenever you exhale, those airways collapse and you're not able to exhale quite as much, and that's why you get those barrel-chested patients with emphysema. On the other side of that, the other disease process present is chronic bronchitis, which is increased sputum production, and they'll have a productive cough. So you get a sputum production for most days of the month, for 3 or more months a year, for more than 2 consecutive years. And so that is the technical definition of chronic bronchitis. You have a lot of sputum being produced for a long time. And that mixed with emphysema, it is what they call COPD, chronic obstructive pulmonary disease. And it might not be, chronic bronchitis can be severe on its own and deadly on its own, as well as emphysema by itself can, be deadly. And so usually it's not an extreme case of either one, whereas it might be just a little of each together are creating this COPD condition. So just something to keep in mind. Now with that, on the chronic bronchitis side, that sputum that they are producing is usually clear or very light colored, and that is pertinent to note that those colors that are present. Let's see. All right. So with patients that have COPD, a lot of times they're on O2, maybe nasal cannula a couple liters per minute, and a lot of times they'll take breathing treatments and steroids, some sort of corticosteroid or something like that, to help with that sputum production and drying that up. When pneumonia is present, you often get fever. You have a change in sputum color, usually becomes more purulent or pus-like, more white, and you get that. Sometimes you might have other signs of infection, maybe they've had a recent surgery or whatever, and they might be weak, they might be lethargic, any other sign of infection that can go along with that. And that's what's going to help differentiate is this a COPD exacerbation or is this COPD with pneumonia? And a lot of times, fever is the first one we want to look at, and then check your sputum, check for signs of lethargy, all that stuff. So with COPD, a lot of times whenever you're listening to lung sounds with those guys, they've got wheezes throughout, and the lungs don't sound that good despite breathing treatments and everything else. They might have wheezes everywhere. Then when you add in pneumonia, pneumonia is usually isolated to 1 or 2 lobes. A lot of times in the bases, the bottom of the lungs are more prone to pneumonia. So you might have some crackles or some other weird noises there in the lower lobes or in a certain lobe of the lung. And that can also clue you in, you've got wheezes everywhere you listen, but also I've got this other weird sound down here in the right lower lobe or whatever, whichever one it might be. And so that kind of clues you in, yep, this is probably pneumonia going on. For pneumonia, the treatment for that is going to be usually antibiotics. So that's not something we can really treat on the truck, but we can help the COPD side with giving a breathing treatment. Go ahead and open them up as much as possible. The breathing treatment might not help the pneumonia side, but it will open up all those airways down into there and help them get the best breath that they can. So that's just kind of some tidbits there for COPD and adding in pneumonia and how to differentiate the two there. Remember, keep an eye on that fever, and changes in sputum are going to be your two biggest things, and then the changes in lung sounds along with that.